Have you ever wondered why your blood sugar continues to rise even though you are taking your diabetes medication as prescribed? Many people assume that medication alone should resolve the issue. In reality, blood sugar control is influenced by far more than medication. Diet, physical activity, stress, sleep quality, and emotional health can all affect how the body regulates glucose. If your blood sugar remains persistently elevated despite treatment, there are several areas worth discussing with your healthcare provider. In this article, we will focus on 4 lifestyle factors that may support better blood sugar control: increasing protein intake, intermittent fasting, exercise, and psychological well-being. 1. Increase protein intake. Let's start with food. Many modern diets are loaded with refined carbohydrates. White bread, sugary drinks, pastries, sweet snacks, and processed foods can cause rapid spikes in blood sugar. Protein works differently. Foods rich in protein are digested more slowly and generally have a smaller impact on blood sugar levels. Protein can also help you feel fuller for longer, reducing cravings and unnecessary snacking throughout the day. Good protein sources include eggs, fish, chicken, turkey, lean beef, beans, lentils, Greek yogurt, cottage cheese, and tofu. Imagine 2 breakfasts. The first consists of sweet cereal and fruit juice. The second contains eggs, Greek yogurt, and a small serving of fruit. The second meal is likely to keep you satisfied longer and may lead to a steadier blood sugar response. This doesn't mean eliminating carbohydrates completely. Your body still needs them. The goal is to create meals that contain a healthy balance of protein, fiber, healthy fats, and quality carbohydrates. For many people, increasing protein intake can help reduce blood sugar swings and improve overall glucose management. 2. Consider intermittent fasting under medical guidance. The second strategy is intermittent fasting. Intermittent fasting is an eating pattern that cycles between periods of eating and periods of fasting. One common approach is the 16-to-8 method, where a person fasts for 16 hours and eats during an 8-hour window. Why might this help? When we constantly eat throughout the day, our bodies are repeatedly exposed to rising blood sugar and insulin levels. Giving the body periods without food may improve insulin sensitivity in some people and allow blood sugar levels to stabilize. Think of it as giving your metabolic system a chance to rest. Intermittent fasting is an eating pattern that alternates between periods of eating and periods of fasting. One common approach is the 16-to-8 method, in which a person fasts for 16 hours and eats within an 8-hour window. Why might this be helpful? When we eat continuously throughout the day, the body is repeatedly exposed to rising blood sugar and insulin levels. Allowing periods without food may improve insulin sensitivity in some individuals
and help stabilize blood glucose levels. Think of it as giving your metabolic system time to rest. However, this is extremely important. Intermittent fasting is not appropriate for everyone. People taking certain diabetes medications, especially insulin or medications that can cause low blood sugar, should never begin fasting without consulting their healthcare provider. Done incorrectly, fasting can be dangerous. But when properly supervised, some individuals find that intermittent fasting becomes a useful tool for supporting healthier blood sugar levels. Point 3. Make exercise a daily habit. The third factor is exercise. Exercise is often described as nature's blood sugar medicine. When your muscles work, they need energy. One of their favorite sources of energy is glucose. As you move, your muscles draw glucose from the bloodstream and use it for fuel. This can help lower blood sugar levels and improve insulin sensitivity. The good news is that you do not need to become a marathon runner. Even simple activities can make a meaningful difference. A brisk walk after meals, cycling, swimming, dancing. Light strength training, gardening. Any consistent movement is better than no movement. Any consistent movement is better than none. Many experts recommend aiming for at least 150 minutes of moderate physical activity each week. One of the most effective habits is taking a 10 to 20-minute walk after eating. This simple practice can help reduce post-meal blood sugar spikes. Remember, consistency beats intensity. A moderate exercise routine performed regularly is often more beneficial than occasional extreme workouts. Point 4, don't ignore psychological healing and well-being. This final point is often overlooked. Your emotional and mental health can significantly affect your blood sugar. When you're under chronic stress, your body releases hormones such as cortisol and adrenaline. These hormones prepare your body for action by increasing the amount of glucose available in the bloodstream. This response is helpful during emergencies. But when stress becomes chronic, blood sugar can remain elevated for long periods. Unresolved emotional distress, anxiety, depression, fear, financial concerns, relationship conflict, and ongoing pressure can all contribute to persistent stress. This is why psychological well-being matters. Stress reduction practices may support better blood sugar control. These include quality sleep, prayer or meditation, deep breathing exercises, counseling or therapy, spending time with supportive friends and family, journaling, relaxation techniques, enjoyable hobbies. Some people focus exclusively on food and medication while neglecting emotional health. But true healing often requires addressing both the body and the mind. Final thoughts. If your blood sugar keeps rising despite taking medication, don't assume the medication has failed. Instead, look at the bigger picture. Are you eating enough protein? Could a medically supervised fasting approach be appropriate for you? Are you exercising consistently? How are your stress levels and emotional well-being? Most importantly, never stop or change your medication without speaking to your healthcare provider.